Here is a review of key points about invasive listeriosis. Key point 1. Invasive listeriosis is rare but deadly. An estimated 1,600 cases of invasive listeriosis and 260 related deaths occur annually in the United States. An estimated 18% of patients with listeriosis die. Overall, Listeria monocytogenes ranks third as a cause of death due to major known foodborne pathogens in the United States. Key point 2. Certain well-defined groups are at higher risk for invasive listeriosis. Higher risk groups include persons who have compromised cell-mediated immunity, such as older adults. In fact, the incidence of listeriosis increases steadily with age after about age 50. Patients undergoing transplants or receiving immunosuppressive medications are at higher risk. Persons with other immunocompromising conditions are also at higher risk. Well-established conditions that confer risk are AIDS and certain malignancies, especially hematologic. Some studies have found an increased risk with liver disease, kidney disease, insulin-dependent diabetes, and alcoholism. In pregnant women, listeriosis may present as a nonspecific flu-like illness or be asymptomatic. The woman does not become seriously ill. However, listeriosis can cause fetal loss, premature labor, neonatal sepsis, meningitis, and death. Key point 3. For higher risk groups, food preparation, storage habits, and food preferences should be considered modifiable risk factors. It's important to remember that unlike most bacterial causes of foodborne illness, Listeria monocytogenes can continue to grow at refrigeration temperatures. This means that storage times are an important consideration for prevention of listeriosis, particularly for foods that are known to favor growth of Listeria. According to an FDA-USDA risk assessment, some of the most high-risk foods include soft cheeses, unpasteurized dairy products, including raw milk, deli and lunch meats, cold cuts, hot dogs, pâté, and meat spreads. Key point 4. Exposed asymptomatic patients who are at higher risk for invasive listeriosis may not need testing or treatment. Food products such as smoked salmon, cheese, sandwiches, and lettuce or leafy greens may be recalled because testing identified Listeria monocytogenes contamination even without any associated case of illness. Unfortunately, there is little scientific evidence available to inform decisions regarding clinical management of persons at higher risk of invasive listeriosis who may have been exposed to Listeria monocytogenes but are asymptomatic. In consultation with a panel of national experts, CDC developed a suggested framework for medical management in these situations. This framework suggests that no testing or treatment is indicated for an asymptomatic patient who ate a product recalled because of Listeria monocytogenes contamination. Such a patient should be counseled regarding the symptoms of listeriosis and instructed to return if develops those symptoms within 2 months of eating the recalled product. Notably, symptoms of listeriosis can differ between risk groups. Older adults and immunocompromised persons typically present with meningitis or septicemia, and they are often severely ill. Common presenting complaints include headache, nuchal rigidity, confusion, loss of balance, seizures, and prostration. These symptoms are often preceded by diarrhea or other gastrointestinal symptoms. For pregnant women, on the other hand, the main issue is infection of the fetus or newborn. These women typically present with fever and myalgias, often preceded by diarrhea or other gastrointestinal symptoms, but these symptoms may be quite mild. Newborns, on the other hand, present with sepsis or meningitis. 2 key prevention messages to take away now are: 1. Persons at higher risk of invasive listeriosis should not eat deli and lunch meats, cold cuts, or hot dogs unless they are heated to an internal temperature of 165 degrees Fahrenheit or until steaming hot just before serving. Persons at higher risk also should not eat soft cheeses unless they are labeled as made from pasteurized milk. 2. No one should drink raw milk or eat unaged cheese or other products made from raw milk. In addition to Listeria monocytogenes, a wide variety of pathogens that are sometimes found in raw milk can make people sick.